15 silent signs. Your heart is crying out for help, and you're ignoring it. Is your heart trying to speak to you right now? Can you identify the dangerous signs that may indicate serious heart problems? Or maybe you're ignoring messages your body is desperately trying to send. The prevailing belief that damage to the heart is always accompanied by clear and noticeable symptoms is somewhat misguided. In fact, factors such as silent inflammation, unperceived stress, or even poor oral hygiene can contribute to heart damage. Misconceptions include the notion that only older adults or those with an inadequate lifestyle are at risk of heart damage. In reality, conditions such as sleep apnea, persistent mental stress, and neglected dental health, among others, play a significant role. And the list keeps growing steadily. If you want to check for silent or subtle heart problems, stay until the end of this content. Do you know the signs that can save your life? We'll also discuss some simple lifestyle changes and medical interventions to improve your heart health and prevent further damage. Let's get started. First, the invisible alert. Unexpected sweating that can save your life. Sudden or excessive sweating can be more than just an embarrassing nuisance. It can represent an important heart warning that many completely ignore. When you start sweating profusely for no apparent reason, especially when you're not exercising, your body may be on high alert. This unexplained sweating occurs when your body reacts to stress signals coming from a heart that is struggling to function properly. Cold and sudden sweat, particularly when accompanied by other symptoms, deserves immediate attention. Your body is literally sounding an internal alarm that many unfortunately confuse with other less serious problems. The difference between recognizing this sign and ignoring it can mean the difference between life and death. If you've ever experienced this type of unexplained sweating, especially if it was accompanied by chest discomfort or shortness of breath, don't hesitate. Seeking immediate medical attention may be the most important decision you will ever make. But what will happen if you keep ignoring this seemingly harmless sign? Second, the sudden fall. When your fainting is a cry from the heart. Loss of consciousness or fainting episodes, often called syncope, can be serious indicators of heart disease. Fainting occurs when the brain temporarily doesn't get enough blood, and in the context of heart health, this can happen due to irregular heartbeats or blockages that impede blood flow. This is a particularly worrying sign if the fainting is sudden and without any preceding symptoms. While fainting spells can have various causes, recurrent episodes or those associated with chest pain or shortness of breath require immediate medical evaluation. You may be thinking that it was just a moment of weakness, but your heart may be trying to communicate something much more serious. Each fainting episode can be a countdown clock to a more serious cardiac event. Early intervention can be crucial in preventing more serious cardiac events that can occur without warning. Don't risk your life by misinterpreting this critical signal. What do you think will happen if you ignore a second or third episode of fainting? Third, the telltale tiredness. Why did your workouts suddenly get harder? Decreased exercise tolerance is a significant indicator that should not be ignored, as it can denote damage to the heart. A sudden drop in your ability to engage in physical activity, feeling unusually fatigued during or after exercise, or experiencing symptoms such as shortness of breath or chest discomfort can all point to cardiovascular problems. This decrease usually occurs because the heart is less efficient at pumping blood and oxygen to the muscles, possibly due to heart disease or blockages in the arteries. What was once an easy walk now leaves you breathless, and that's not simply a lack of conditioning. It's your body telling you that something isn't working as it should. If you notice a marked change in your exercise tolerance, it's important to consult with a healthcare professional. The sudden deterioration of your physical capacity is like an alarm that should not be silenced. Addressing this symptom promptly can be key to identifying and managing heart conditions effectively. How many times have you wondered why you can no longer do what you did easily a few months ago? Fourth, the treacherous pain. What your calves are trying to tell you about your heart. Calf swelling or pain can be a potentially alarming indicator of peripheral artery disease, often linked to heart damage. This condition arises when the arteries in your legs become narrowed or blocked, leading to reduced blood flow. It is crucial to recognize this symptom early, as it can signify broader cardiovascular problems, including heart disease. If you notice that your calves are swollen or sore, especially after walking or climbing stairs, it's a sign to pay attention to. Peripheral artery disease is commonly associated with atherosclerosis, where plaque buildup occurs in the artery. Your legs may be suffering, but it's your heart that's really in danger. When your calves hurt for no apparent reason, your circulatory system is sending an alert that can't be ignored. To prevent further complications, lifestyle modifications such as regular exercise, a heart-healthy diet, and quitting smoking are recommended, along with consulting a healthcare professional. Remember, recognizing and treating these early signs can be critical to maintaining your heart health. Fifth, the voice of danger. How hoarseness can reveal hidden heart problems. Persistent hoarseness can be an unexpected but possible symptom of heart failure. This condition can occur when the heart doesn't pump blood as effectively as it should, leading to fluid buildup in the lungs and affecting the voice box, or causing a chronic cough. This symptom is often overlooked, but it may be associated with worsening heart function. The hoarse voice that doesn't go away after weeks may be trying to warn you about something much more serious than a common cold. If you experience persistent hoarseness without a clear cause, such as a cold or allergy, and especially if it is accompanied by other symptoms such as shortness of breath or fatigue, it is important to consult with a healthcare professional. When your voice changes without explanation, your body may be literally screaming for attention. Identifying and treating heart problems early can be vital for long-term health and well-being. What is your body trying to say when your voice seems constantly tired or altered? Sixth, mirrors of heart health. The secret your nails are revealing. Your brittle or stretch mark nails may be revealing much more than a lack of cosmetic care. These nail changes are often overlooked, but they can be silent signs of serious heart-related circulatory problems. Vertical or horizontal stretch marks, bluish discoloration, or extreme brittleness may indicate that blood is not properly reaching the extremities of your body. This phenomenon, known as the peripheral manifestation of cardiovascular disease, occurs when the heart cannot pump blood efficiently to all parts of the body. Watch your hands and feet with extra attention, as they may hold vital clues about your heart health. The changes in your nails are like tiny heart monitors at your fingertips, flagging problems before they become critical. Nail changes, especially when accompanied by other symptoms such as fatigue or shortness of breath, merit a thorough medical evaluation. Don't underestimate these visible signs that your body is deliberately presenting. Have you ever noticed changes in your nails that you ignored because you believed they were just aesthetic problems? Seventh, the mouth speaks. When your bleeding gums are a red alert for the heart. Gums that bleed easily may seem like a minor problem, but they can be a subtle sign of heart disease. Gum disease, or periodontitis, is often linked to heart health. Inflammation caused by persistent gum disease can lead to swollen and bleeding gums, and this same inflammatory response is believed to increase the risk of heart disease. Bacteria from inflamed gums can enter your bloodstream, potentially affecting your heart health by contributing to plaque buildup in your arteries. Your oral health isn't an isolated system. It's deeply connected to your body's overall health. Taking care of your oral health isn't just about preventing cavities, it's also about maintaining your heart health. The connection between your mouth and your heart is like a two-way highway, where problems on one side inevitably affect the other. Regular dental checkups, proper oral hygiene, and treating any signs of gum disease early are key preventative measures. When was the last time you took persistent bleeding gums seriously? Eighth, the stomach knows, the indigestion that can be a heart attack in disguise. Unexplained nausea or indigestion can be more than just digestive discomforts. They can signal heart disease. Often, people experiencing a heart attack may have symptoms similar to indigestion, nausea, or stomach pain. Discomfort is typically not relieved by antacids or other gastrointestinal treatments, which should raise an immediate alert. These symptoms occur because, during a cardiac event, the heart may struggle to supply oxygen-rich blood to the digestive system. Many people, especially women, experience heart attacks without the classic chest pain, experiencing only digestive symptoms. This is one of the reasons why heart attacks in women are often misdiagnosed or detected late. Don't ignore lingering digestive discomforts. Your stomach may be trying to warn you about your heart in danger. Especially if accompanied by other heart attack symptoms like chest discomfort or shortness of breath, these signs should not be ignored. Seeking immediate medical attention can be crucial to addressing these underlying heart problems. Have you ever mistaken a potential sign of a heart attack for simple indigestion? 9th, the alert mind, when your anxiety is a secret heart message. Unusual or prolonged anxiety is not only a mental health concern, but it can also be a symptom of heart disease. Anxiety can manifest physically, affecting your heart rate and blood pressure, and in some cases, it can signal an underlying cardiovascular problem. This sign is particularly worrisome if it is sudden, severe, or accompanied by other symptoms such as chest pain or shortness of breath. What you may be dismissing as just anxiety may actually be your body detecting subtle changes in how your heart is functioning. Your brain and your heart are intimately connected, and a problem in one often affects the other. Although anxiety has many causes, it is important not to rule it out, especially if it is a new condition or has intensified significantly. When your anxiety appears with no apparent cause, your body may be experiencing an internal alarm that your mind is interpreting as fear. Consulting with healthcare professionals to explore both psychological and physical aspects can be vital to ensure heart and overall health. Have you ever stopped to think if that panic attack was really just stress or something else? 10th, the hidden connection, the surprising link between erectile dysfunction and heart attacks. Erectile dysfunction, often overlooked, can be an early warning of heart disease. This condition is not just a personal inconvenience, it is a critical indicator of health. Erectile dysfunction occurs when there is insufficient blood flow to the penis, often caused by underlying problems in the cardiovascular system, such as clogged arteries or heart disease. It is essential to understand that the same processes that lead to heart disease can affect blood vessels anywhere in the body, including those leading to the sexual organs. These are actually some of the smallest vessels in the body, and they can show problems before larger vessels are affected. This means that erectile dysfunction can appear years earlier than traditional cardiac symptoms, offering a crucial window for preventative intervention. Erectile dysfunction is like an early warning system for your heart. Ignoring it can be a missed opportunity to save your life. If you're experiencing this problem, it's not just about your sexual health, but potentially about your heart health as well. Treating lifestyle factors, seeking medical advice, and managing other heart disease risks are all crucial steps in dealing with this symptom. When was the last time you considered that problems in intimacy could be related to the health of your heart? 11th, the skin that alerts, mysterious rashes, that signal heart problems. Irregular rashes or unusual spots can be more than just a skin problem. They can be subtle signs of heart disease. Certain types of rashes, such as psoriasis or eczema, are linked to an increased risk of heart problems. These skin conditions are marked by inflammation, a critical factor in the development of atherosclerosis, the hardening of the arteries that can lead to heart attacks. Additionally, some rashes or spots may result from poor circulation, another sign of heart problems. Chronic inflammation in the skin can be a reflection of what's going on internally in your blood vessels. Your skin, the largest organ in your body, often reflects what's going on internally. When your skin develops unusual patterns or persistent rashes, it may literally be showing the signs of your cardiovascular system's internal battles. Pay attention to any sudden or chronic changes in the appearance of your skin, and consult with a healthcare professional to explore the underlying cause and connection to heart health. Have you ever made the connection between persistent skin problems and your heart health? 12th, the night danger. How your snoring may be silently choking your heart. Snoring or sleep apnea, conditions often dismissed as mere nuisances, can indicate more serious heart health problems. Sleep apnea, characterized by pauses in breathing or shallow breaths during sleep, isn't just about loud snoring. It's a serious disorder that disrupts your sleep cycle and reduces the flow of oxygen to your body, putting enormous strain on your heart. Those with sleep apnea often experience higher blood pressure, irregular heartbeats, and are at higher risk for heart disease and stroke. While you sleep, your body should be resting, but with sleep apnea, your heart is working overtime. Every breathing pause during sleep is like a little choking for your heart, forcing you to work harder to keep your body functioning. If you or your partner notice heavy snoring or lapses in breathing, it is crucial to consult with a healthcare professional for a proper diagnosis and treatment. This can include lifestyle changes, CPAP machines, or other interventions that can dramatically improve your heart health. Taking sleep apnea seriously can be a vital step in protecting your heart. Have you ever woken up panting in the middle of the night, unaware that your heart was struggling while you slept? 13th, the silent collapse, the sudden weakness that precedes the infarction. The sudden onset of extreme weakness is a critical and alarming symptom that can indicate a heart attack. This profound weakness or fatigue isn't just feeling tired, it's an intense and overwhelming feeling of exhaustion that can appear without warning. It's your body's way of signaling that your heart may not be pumping effectively, leading to reduced blood flow and oxygen delivery to your muscles and organs. Many people report feeling unexplained weakness days or even weeks before a full-blown heart attack. This symptom is particularly worrisome when combined with other signs of a heart attack, such as chest pain or shortness of breath. Extreme, unexplained weakness is as if your body is shutting down non-essential systems to direct energy to your struggling heart. Immediate medical attention is crucial if you experience such extreme weakness, especially if it is sudden and unexplained, as it could be a life-saving intervention. Don't dismiss extreme fatigue as just stress or lack of sleep. It can be much more serious. Have you ever felt your limbs heavy and depleted of energy all of a sudden, not understanding what your body was really trying to say? 14th, the dangerous restraint. What ankle swelling really means. Unexplained swelling of the ankles may seem like a minor problem, but it frequently signals serious heart problems that many overlook. This swelling, known medically as edema, occurs when the heart is not pumping blood efficiently, causing fluid to build up in the lower extremities. Swollen ankles and feet are often the first place where this problem becomes visible, as gravity pulls excess fluid down. What makes this sign particularly insidious is that it usually appears slowly, making it easier to rationalize it as something temporary or age-related. However, when both ankles swell regularly, especially at night, and form depressions when pressed with a finger, it's time to seek medical attention. Your ankles are like gauges of your heart's efficiency. Swelling is a clear warning that your pumping system may be failing. This symptom may indicate congestive heart failure, a condition where the heart struggles to meet the body's needs. Ignoring this symptom can lead to disease progression and life-threatening complications. How often have you been ignoring your squeezing shoes at the end of the day, not realizing what it really means? 15th, the fatal tingling, the nerve signals that warn you about your heart. The tingling sensation in the limbs is an often overlooked sign that can have serious implications for your heart health. This tingling or numbness, particularly when it occurs on one side of the body or in both arms, can indicate compromised blood flow due to cardiovascular problems. When arteries are partially blocked, the blood supply to nerves and tissues is reduced, resulting in these disturbing sensations. Even more worryingly, sudden tingling, especially when accompanied by other symptoms like chest pain or shortness of breath, can be a sign of an impending heart attack. Many people dismiss these sensations as poor posture or pinched nerves, missing a crucial opportunity for early intervention. Persistent tingling is like your body's emergency communication system. Ignoring it can cost you your life. This symptom is particularly important for diabetics, who are already at increased risk of cardiovascular problems and may confuse these signs with diabetes-related neuropathy. If you are experiencing unexplained tingling, particularly if it is recurrent or accompanied by other symptoms, seek medical evaluation immediately. How many times have you felt your fingers or arms tingle and just shaken them without considering what your body was actually trying to communicate? Protective Shield. Powerful strategies to shield your heart from fatal damage. Now that we understand the signs indicating potential heart damage, let's turn to the crucial steps you can take to improve your heart health and mitigate further damage. It's never too late to start making these changes, and often small steps can lead to big improvements in your cardiovascular health. First, focus on your diet. Reducing your intake of saturated fats, trans fats, and cholesterol-rich foods is key to protecting your heart against arterial blockages. Opt for a diet rich in whole grains, fruits, vegetables, and fatty fish like salmon or mackerel, which are known for their heart-healthy omega-3s. Be mindful of your salt intake to manage blood pressure and limit sugar to avoid excessive weight gain and diabetes, both of which put a strain on the heart. Every healthy meal you choose is like depositing into your heart bank account. The dividends will be paid out in years of healthy living. Physical activity is equally vital. Engage in at least 150 minutes of moderate aerobic exercise or 75 minutes of vigorous activity each week to strengthen your heart muscle. Exercise not only helps you maintain a healthy weight, but it also reduces stress and revitalizes your entire cardiovascular system. Monitoring and maintaining a healthy blood pressure, cholesterol levels, and diabetes are critical. Regular checkups and following prescribed medications can keep these factors in check, significantly reducing the risk of heart disease. Don't underestimate the power of quitting smoking and limiting alcohol consumption. Both of these habits have a profound negative impact on heart health, and ditching them can drastically reduce the risk of coronary heart disease, among other benefits. Manage stress through mindfulness, meditation, or yoga. Chronic stress can lead to behaviors and factors that increase the risk of heart disease. Finding healthy ways to cope with stress can improve your heart health and overall well-being. Remember, protecting your heart is not just about adding years to your life, but adding life to your years. You now possess knowledge that many do not have, the ability to recognize 15 silent signs that can save your life. This power of early detection is like having a protective shield against one of the greatest threats to your existence. But knowledge without action is just unrealized potential. Today is the perfect day to make a change. Start small, maybe an extra walk, a healthier meal, or finally make that doctor's appointment you've been putting off. Each positive step creates momentum for the next. Your heart works tirelessly for you 24 hours a day. It deserves your care and attention in return. Imagine what it would be like to have the confidence of knowing that you're doing everything you can to protect your most precious asset, your health. Don't wait until it's too late. Don't wait until one of these 15 signs becomes an emergency. Take the reins of your heart health today. Your future self will thank you for the decision to prioritize your heart now. After all, this isn't just about living longer, it's about living better, with the energy and vitality to enjoy all the precious moments life has to offer. The choice is yours, and the time to act is now.